you so much for joining this conversation. We're focusing today on the most vulnerable populations and looking at actions to promote healthier informal communities through placemaking. We're really pleased to have over 350 registered for this morning, this afternoon, this evening, wherever you may be, from over 50 countries. This is being recorded for viewing and sharing later, and we encourage you to share on social media using hashtag PlacemakingXLive and tagging PlacemakingX. I want to start by introducing myself. I'm Ethan Kent. I'm the executive director of PlacemakingX. PlacemakingX is a global network of leaders who together accelerate placemaking as a way to create healthy, inclusive, and beloved communities. And I want to talk about the placemaking movement really emerged trying to, in a sense, bring more informality to respect informal uses, informal processes for shaping public spaces. In our work, perhaps more in the US, but around the world, it's really based on the idea that the community is the expert, especially in informal, more low-income parts of the world. And so this conversation is built on this idea that we need to learn from the innovation that's happening in informal communities, respect it, build on it, and build from the expertise globally that's reflected in this wonderful panel of experts that are working on the front lines in informal communities on placemaking related work. So before we get to the panel, I'm excited to get to introduce Cecilia Anderson who leads the public space program at UN Habitat. They've been a close partner of ours for 10 years now, building the case for public space as a cause, as a focus of global development, building these wonderful learning networks of people around the world as advocates that had formerly been sort of alone in their efforts and connecting us all and realizing the incredible wealth of wisdom and experience that is out there. And so PlacemakingX is really set up to connect, amplify these advocates, these actions. And today we're going to delve into some of the great actions that we want to continue to be able to amplify with these people, with these panelists, and share what everybody's doing. But with that, I'll turn it over to Cecilia Anderson, the director of the public space program at UN Habitat, to sort of help frame the conversation. Thank you, Cecilia.
Oh, thank you, Ethan. And can you hear me?
Yes. Yeah.
Yes.
Oh, super. Good. At least the technology worked. No, thank you very much, Ethan. And I think it's such a pleasure to actually be here and to join you, because I think this theme that you have for this webinar today is so important for us at UN Habitat, because the impact of COVID-19 will be most devastating for the poor in many of our cities. There's 1 billion people living in informal settlements globally, and they will be the hardest hit through this pandemic. And these areas are really densely populated, even on the verge to overcrowded, with poor water and sanitation, little or no waste collection, limited access to formal healthcare facilities, and close to non-existent open public spaces. So there's urgent action that is needed now to enable residents to stay safe and healthy. Many of the recommended measures to prevent COVID-19 transmission, such as the hand washing, the physical distancing, the self-quarantine and self-isolation, or community-wide lockdowns, are often near to impossible in many of the poorer communities and informal settlements. People do not always have reliable running water, families share just 1 or 2 rooms, and there is seldom, like I mentioned before, adequate space for that physical distancing. So many slum residents, also they work in the informal sector. I think in Africa, for example, about 61% of the urban employment is actually in the informal sector. And each group of the informal workers produces goods or services that are essential to the functioning of the economy. But as cities are shutting down, many of them are losing their livelihoods. And there are no safety nets for many of those people. But communities in informal settlements and slums have a powerful asset. They're actually really resilient. They have an immense capacity to self-organize and to tailor innovative low-cost solutions to manage the spread of COVID. And we've been seeing a lot of that happening. And these are the examples that will probably be discussed during this session. They just have a need to be empowered. And placemaking can probably provide that vehicle for empowerment. Because the pandemic hits the most vulnerable the hardest, we need to act very quickly to save more lives. We need to leverage on the experience, the expertise, and the partnerships to be able to deliver solutions. And that is why our Executive Director at UN Habitat, Maimouna Sharif, actually launched a COVID response plan a couple of weeks ago, which is really about supporting local governments and communities to drive those solutions in informal settlements, to provide that crucial data to have more informed decision making, and also to try and mitigate economic impact of COVID and to initiate recovery. Finally, I'd like to invite all the participants to join the call to action to support the vulnerable populations most in need on the new front lines. It is only by joining forces that we will be able to emerge much stronger, and they will be able to emerge much stronger to enable those communities to thrive and to prosper. And I'm very much looking forward to these discussions today and to actually tap into a lot of that expertise and experience that a lot of the panelists will be sharing. So thank you very much, and looking forward to the discussions.
Thank you so much, Cecilia, for that inspiring introduction. And thank you for your longtime work and that of a great team at UN Habitat for bringing us all together in many forums. And it was wonderful to be, many of us were together at the World Urban Forum in Abu Dhabi this past February, where we got to launch Placemaking X and many of the regional placemaking networks that are out there as well. So, and with that, I'd love to introduce our panel of experts and practitioners. First, we have Sarah Ruel Bergeron, who's the Director of Projects and Development at Archive Global. We also have Danielle Resnick, PhD, who's a Senior Fellow, Research Fellow and Theme Leader on Governance at the Institute for Food Policy Research, with Emily Roel, Founder and Director of Doain, is doing wonderful placemaking and preservation work in Yangon, Myanmar. Sumer Saliba, who's the Urban Technical Advisor at the International Rescue Committee. Caroline Skinner, Director of Urban Research at WIGO. Mark Ojal, also with the UN Habitat Public Space Program, and helped found Placemaking Nairobi, has been a great placemaking advocate in Nairobi and around Africa. And lastly, Mike Zuckerman, who's been doing placemaking in informal communities and refugee communities in several parts of the world. Is also a fellow at the Institute for the Future and a creative activist with TO.org. And then lastly, I'll introduce our moderator, Giselle Seabag, who has been a great partner in helping to launch Placemaking X over the last year. Used to lead the Built Environment Tract at the Clinton Foundation. Has a broad, depth of experience in public spaces and in planning and development around the world, in public health as well. And she's now at Bloomberg Associates, working in several cities on these types of issues. So with that, I'll turn it over to Giselle. Thank you so much.
Thank you so much, Ethan, and thank you, Cecilia, for your framing remarks. I know that it's inspiring for all of us to be together and to think of ways that we can take action. We are absolutely delighted to have so many of you join us today as we highlight the groundbreaking ways that multilaterals, NGOs, grassroots organizations, and citizens are coming together to address this crisis. And at the same time, promoting physical, mental, and emotional health in the communities around the world that are most at risk. And, I know for so many of us, certainly myself included, it's been hard to not feel helpless sometimes, or even useless, as we watch this pandemic unfold in places across the world with far fewer resources, and places where we've all been working to solve truly essential health, infrastructure, housing, and equity challenges before all of this even began. And so for that reason, we've organized this event a little bit differently than many of our others, with the hope that this will serve not only as an opportunity to connect with professionals carrying out life-saving work on the ground, but also to illuminate opportunities to directly support actionable initiatives that make an impact on people's lives today. And so we're so excited to dive into these critical challenges and the solutions and the many opportunities today with our speakers. And so today we're going to start with a moderated conversation, and then around 11 o'clock Eastern time, I know it's, you know, afternoon and evening for many of you too, we'll move on to a Q&A from the audience. And so for those of you who'd like to submit questions, you can do that by submitting them and even voting up the ones you want answered in the Q&A box that you should have at the bottom of your screens. And then panelists, I just want to remind everyone that you're going to hear our bicycle bell ring when your time is up. So please just take that as your signal to summarize your comments so that we can be sure to hear from everyone. And so with that, I'm going to get started with the first questions. And I would like to ask each panelist to introduce themselves and their work and to describe the biggest threat that they are seeing to slowing down the COVID pandemic in the vulnerable populations that they're working with globally. And so Sarah, I'd like to start with you.
Great, thanks so much. Hi everyone, and thank you Placemaking X and Giselle for inviting us to be a part of the panel. I'm a licensed architect and the Director of Projects and Development at Archive Global, a small nonprofit based out of New York City. We implement household interventions designed to combat diseases in vulnerable communities worldwide. We pair this with a research study to understand the impact of the change, measuring pre- and post-intervention health outcomes with a control and a study group. We also create an advocacy campaign to bolster health literacy within the community and build capacity with local partners and tradesmen. Regarding the question of the single largest threat, I think what's difficult with COVID-19 is how complex the impact is, and I'll actually be kind of reiterating some of the things that Cecilia has already introduced. And I'm sure the panelists today will help to unpack some of this complexity. What I'd like to bring to the table is how important inadequate housing is in the context of COVID-19. 1.6 billion people around the world live in inadequate housing. These homes are mostly overcrowded and poorly ventilated, so distancing from others is impossible. And if someone becomes sick, the spread of disease, particularly respiratory diseases, is inevitable. Extended families often live under a single roof, so a highly exposed essential worker may be coming home daily to a high-risk elderly person. 3 billion people lack basic hand washing facilities. As we all know, hand washing is one of the most important ways to protect yourself and your family from contracting or spreading COVID-19. Another important way is physical or social distancing. I've mentioned this isn't possible at home, but it's often not possible outside of the home either. 1 billion people are living in informal communities, and most of these are connected by small and narrow passageways that may not even be as wide as 6 feet. And people have to go out multiple times a day. 2 billion people lack sanitation services, and 673 million people still practice open defecation. So going out may be necessary just to relieve themselves. If sanitation facilities are communally available, they likely don't have hand washing stations and see a large number of people a day. Surfaces are touched often and lines may be long. With low incomes and unreliable access to power, most homes won't have a refrigerator. And so storing food becomes impossible and visiting the market is necessary multiple times a week. Hopefully that market is accessible by foot, but at times it requires the use of public transportation. So these are only a few examples of how inadequate housing can exacerbate the spread of COVID-19. It doesn't account for the fact that people have been living in these conditions for extended periods of time. Homes that are damp, vermin infested, poor at regulating manageable temperatures, whether that's hot or cold, and overall are highly stressful environments. With little access to health services, these conditions cause or exacerbate health conditions, and so most people living in inadequate housing entered the pandemic with poor health, making them particularly vulnerable to the spread of COVID-19. I'll stop there before my bell.
That's great. Thank you so much. I think that it does reiterate a lot of what Cecilia said, but gives a lot of detail also to thinking about how people are living day to day. Danielle, let's move to you.
Okay, well, thank you very much, Giselle, and thanks for the invitation to participate in this event. As was noted earlier, I work for the International Food Policy Research Institute. This is a think tank based in Washington, D.C., but we have offices across Africa and Asia. And not surprisingly, given our mandate, we have been most focused on the implications of COVID-19 for the food system. My particular area of focus is on informal food traders in sub-Saharan Africa. And in that area of the world, food trade is the second biggest component of the agri-food system outside of agriculture. Informal food trade, which we refer to as food sold in wet and open air markets, as well as by street vendors set up in stalls on the side of the road or mobile hawking, is one of the largest sources of employment in urban Africa, particularly for women. And some estimates also suggest that the urban poor access up to 70% of their food from informal retailers. So in response to Giselle's question, for me, the single biggest threat is the lack of trust between food traders and government authorities. There's long been very contentious relationships between traders and African governments for a number of reasons. One, street hawkers in particular are often deemed to be anathema to the notion of a clean, modern city. But at the same time, the urban poor, inclusive of hawkers and marketeers, are a large voting constituency. And so we often see cycles of crackdowns and co-optation of food traders that can coincide with the electoral cycle. Second, within open air markets, our past research in places like Zambia, Ghana, and Nigeria show that traders really resent paying operating permits and levies to local governments and not receiving adequate services such as clean water and sanitation in exchange. And so collectively, we found these trends are detrimental to fostering political trust, especially in local government authorities. I think this lack of trust is exacerbated when we've seen repressive measures used against traders, such as in Harare, Zimbabwe, where there's been outright destruction of some of the markets and stalls in response to decongestion policies in light of COVID. In parts of Uganda, there's been reports of live bullets being fired over traders' heads who do not adequately social distance. In other cases, we're seeing food markets being decongested by moving traders to different parts of town, like in some secondary cities in Kenya. And this can often reflect a lack of understanding about the spatial nature of food systems, and that traders choose to vend based on links to consumer bases and ties to food suppliers. By extension, though, I think this trust can be built up by engaging with representatives of food traders at the outset and communicating with them about viable options. So in Ghana, for instance, there was a strong level of communication with market queens at the outset of this outbreak. All markets across the country were first fumigated during their lockdown, and then the market women were divided into 4 or 5 groups, depending on the size of the market. They were given different color tags so that only a particular proportion of sellers could be present in the market at a particular day. And so this allowed the market traders to continue their livelihoods, but still decongesting the markets. So I think especially as countries are beginning to exit lockdown, and as we have to rely more and more on citizens' behavior to maintain social distance, wearing masks and following other measures for the public good, enhancing this trust between traders and the government will be crucial. Thank you.
Thank you so much, Danielle. That's absolutely fascinating. And I think it's so important and something that probably we haven't all focused that much on. And I think, making sure that there's a really strong dialogue between government and food traders is of critical importance. So thank you for highlighting those points. So Caroline, let's move to you.
Hello, everybody. Thanks for the privilege of this opportunity. So I'm Caroline Skinner. I work for WeGo, which stands for Women in Informal Employment, Globalizing and Organizing. A somewhat unwieldy acronym, but we're an action research network which focuses on the informal workers with a gendered lens. So we have activities in 90 countries, or activities and or partners in 90 countries. With a core constituent being membership-based organizations of informal workers. So as you can imagine, we have done nothing but focus on the impact of the COVID crisis on informal workers. And just to complement the 2 speakers who have spoken so far, or 3 speakers, but really with an informal economy lens or an informal worker lens, I would say that the single biggest threat in slowing down the pandemic with informal workers is lack of income. So for the 2 billion informal workers, so your figure, according to the ILO, Cecilia, is actually a global figure, and the figures go up if we look at the African continent. So 2 billion people, that's 62% of all workers in the world are informal. What we're hearing back from our membership-based organizations is the directive to stay at home can actually, and in many cases, is a call to starve. So in my own country, South Africa, there was a survey done 2 weeks into lockdown, and 2/3 of township residents food. So I would say, and it's not a particularly urban intervention, but I think it is what we have to have on the agenda, first and foremost, is around income support. So we've been direct income support. So it allows people to stay at home as much as possible with all the caveats of where they live, etc. So we've been monitoring very closely where this has happened. The World Bank's a good place to look, where they've been monitoring the introduction of new cash transfers. So we see there's 104 countries that have introduced these grants. But we're hearing back from our informal workers that implementation is so slow, and sometimes informal workers are kind of falling between the cracks. So if you just ask me for the single biggest threat, this is what I would say it is. So that's enough for me for the moment.
Absolutely, it's so critical, and I think it's something that we're seeing across the world, is that people are being asked to either, you know, stay at home and lose their income to try to, you know, prevent this threat of COVID, versus just, you know, not having income the next day to even eat. So it's such an important issue. And Caroline, I'm so glad that WeGo is there, you know, to connect with some of the people who are probably not accounted for, and who the government might not have data for, and they're unable to reach. So it's so important that organizations like yours, I think, is there and connected and can provide people with that information, because it is so critical. So thank you. And Mark, let's move to you.
Yeah, my name is Mark Ujal. I work with UN Habitat. I'm an urban designer and placemaking enthusiast, and I've slowly become a placemaking expert. And we work across the continent and globally to support communities to transform open spaces into interesting and sticky places. And in Nairobi, we are working with a group of civil society organizations and the government and community groups to transform public spaces and to heighten awareness on the need and importance of public space. So that's really what Placemaking Nairobi also does. And at the continental level, we are building a network of public space advocates and practitioners. This is anchored in South Africa, and it's something that we hope that will actually heighten the place of public space in the policy agenda across the continent. In terms of what I see as one singular threat to this, to COVID-19 spread in informal settlement, one thing I see is inadequate government support. We cannot run away from the role of the government. And in this case, what I mean is protection of the most vulnerable people. Now we see increased cases of evictions in slums and informal settlements, not just by the government, but also by structure owners who evict tenants. And some of them are so inhuman because they take out roofs, and they take out doors. So this is something that the government needs to take a stand on, because there are laws that protect the rights of tenants and rights of landlords. That's really something that we see as something that needs to be done. The other thing is information. Again, the role of the government in ensuring that the flow of information is not just plausible, but trustable. It is verifiable. We are seeing that increasingly people are losing trust in this information. People are asking, okay, you're giving us numbers, but where are these people? So we need to ensure that there is flow of information, the right information, because again, we are in an age of lots of funny theories, So the government needs to be clear and work with civil society partners and people who are familiar with these communities. They've built trust over the years, and breaking down this information becomes really critical in ensuring that information gets home.
Mark, I think you bring up so many great points. Governments are really responsible for supporting the most vulnerable, and we're seeing the ways that they're not, and they haven't been for a long time. But I think that this crisis, this global pandemic, is actually highlighting the ways that they are still missing key parts of their constituencies. So that's super important. And then I think your other point also about communications is one of the things that, I've seen as one of the most critical things that governments can be doing. And really very few governments are doing a good job, where the communication needs to be consistent, clear, and evidence-based. And there really needs to be a true effort to counter misinformation, because dangerous ideas are getting out there that are not based on data or science. And I think it's so important to consider that. So thank you for highlighting those important issues. Emily, we'd love to hear from you too.
Hi, everyone. I couldn't figure out the tech and have the same fancy background, so you have to do with the dark evening here in Yangon. So my name is Emily. I am originally from the Netherlands, but I moved to Myanmar about 7 years ago. And I started a urban regeneration organization here called Do-Ain. Do-Ain means our home in Myanmar language. And we are a team of about 35 researchers, urban designers, architects, public outreach specialists. And we work on a variety of heritage preservation, public space, and also capacity building and awareness raising programs. Yeah, a small disclaimer for the discussion tonight is perhaps that the number of cases has officially been very limited in Myanmar. I just checked the statistics, and officially there are 206 cases as of today and 6 deaths. It's widely sort of appreciated that there are a lot of unreported cases, no doubt, but at the same time, there hasn't been a rush on the hospitals here either, or lots of people dying with symptoms similar to COVID-19. So yeah, the extent of the health threat here is still a bit sort of, yeah, no one is exactly sure yet how bad it might still get, or yeah, what might still happen. So a lot more of the discussion here is really now around yeah, economic impacts. Of course, as everywhere else in the world, a lot of restrictions have been put in place here. Travel restrictions, mandatory quarantines, lockdowns of parts of the city, curfew orders. And yeah, of course, these have had a huge impact, and very much so also on informal workers. Street vendors, tricycle drivers, informal waste pickers, they've really seen their income disappear or drastically reduce overnight. And so my point in terms of what is the biggest risk for the spread of COVID-19 is very much related to the point that Caroline also made, which is around the need for income support. And maybe I'll focus it even more so on the challenge of reaching these informal people with support. Yeah, like Caroline also said, the need for income support is so crucial so that we can provide, or so that informal workers can be provided with, yeah, a choice to stay at home or continue activities, but do so safely. But that's only possible if there is income support. And yeah, given all the many issues around identification here, lack of household registered data sets, that is really a huge challenge, like how to reach people in the informal economy, and also how to do it in a somewhat sort of reliable or robust way so that you can set up programs that are yeah, robust enough to really scale and attract sort of larger sources of funding. Yeah, I would say that that is a big issue.
Thanks, Emily. You bring up many important points, and I have to wonder if perhaps this is an opportunity, since you haven't seen the exponential growth yet in the cases, to see what kinds of opportunities the government can actually get to people now to help prevent the widespread you know, spread of this illness, while also considering how to get resources to people, or at least how to get workers out making money in a safe way. So thank you for sharing that perspective. Mike, we would love to hear also from your perspective. I know that you're in sort of, you have a different context that you're coming from, so please.
Yeah, so I'm Mike Zuckerman. I'm a passionate space activator since my junior prom. I've done everything from environmental nightclubs to a network of free spaces in 17 different countries around the world. But the last 4 years, I've really turned my attention to creating places and spaces in refugee context, starting in Greece, then in Bangladesh, and now in Uganda. I've been to about 80 different refugee camps around the world. So this does make me experienced, but I would not say I'm an expert with the answers, and I am certainly not the hero of the story. I'm simply trying to put resources agency and decision-making in the hands of local people because they know best, or as Ethan said it, that the community is the expert. All of my work kind of focuses on that, and also kind of getting rid of this agency deprivation disorder, I've heard it called. Uganda is one of the best countries in the world as far as refugee policy goes. Refugees are allowed to work, they're allowed to move freely, and they have the third most refugees in the world, most in Africa. We have a policy at TO.org of 50-50, that we do 50% of our initiatives for host community and 50% for displaced people. So some of our work happens in the slums in Kampala, where we're doing hand washing stations and mask making. And then the majority of our work happens in Nakivale refugee settlement. It's a 62-year-old refugee settlement, over 100,000 people. So by age and by population, it is a city, but it's lacking certain things that cities have, like public spaces, like monumental art, and as I mentioned before, kind of this agency and self-sufficiency and democracy. But it's a Pan-African city. It's got people from 10 different nations represented, and it's really a place that I've just completely fallen in love with. As far as the work we've been doing here, that the whole world's kind of turned upside down. One of the things we've been making here is a new town square, kind of inspired a bit by ancient Greece and the Agora, and then also a bit by Burning Man and their Playa. But those spaces have closed during this time, but the community that has grown, and this kind of proving the fact of public spaces leads to resilience, a lot of the members that have been congregating around these public spaces have come together to create music that's in every language in the camp, to create all sorts of different campaigns that, even though the public space isn't open, those connections have maintained. As far as the main challenges, there's so many, but I would say it's about crises. Like, for example, in Bangladesh, there's looking at a cyclone that's been coming in. And people are talking about in America, what happens if another hurricane comes? So like, how do you manage a crisis when there's already a crisis? And that's kind of been the case here. I was here before COVID dealing with a large number of displaced people coming in from Congo, and they have been, there's usually a procedure to deal with that where they put them at a reception center for several months. But because of they're trying to decongest that, they basically just drop people off and don't have access to water or even shelter, even washing their clothes. So some of the guidelines are not really, they're created more for cosmopolitan cities, like WHO being slow to recommend masks or still not recommending them. There's no chance for social distancing, especially in the not only living situations but food distribution. There's a huge, and like WFP has set up some spatial reorganization, but then on the edge of that is huge amounts of people. So I'd say it's crises, trust, and the biggest thing is kind of capacity building of local CBOs to be able to increase their accountability and accounting records so that they can receive funds from larger groups like UN and UNDP, so that they're able to do the response, which they're very crafty at doing. But they're still hard. There's a barrier to letting some of these CBOs getting access to the funding because of their lack of organizational development.
Mike, thank you so much. I think that perspective is so important, and I'm so glad that you could offer us, a viewpoint on the displaced persons that you're working with and on the different contexts that you're working with. All those things are huge challenges for all of us. And so lastly, I want to move to Sam to give us sort of that overview of the larger NGO work that IRC's been doing.
Yeah, thanks for having me. So as mentioned, I'm Sam Saliba, Urban Advisor at the International Rescue Committee, where we work in over 40 countries serving people whose lives have been affected by crisis to survive, recover, and regain control of their lives. And obviously that number has increased exponentially. I want to answer the question specifically. I think from my perspective, the majority of displaced around the world, as was touched on, as Mike spoke about a little bit, are not necessarily in camps, but in towns and cities around the world. And just as cities are on the front line of this crisis, that means displaced refugees and IDPs are on the front line of this crisis. And what is the biggest risk that they face? I think it's twofold. I think one, they risk not being included in the solutions that are provided for them in this crisis. And two, they risk that this crisis is treated as a symptom without understanding the root causes that are addressing it and driving it. And I think if we're just talking about response in informal communities, then we've completely missed the point. There's preparedness, there's response, and there's recovery that really needs to be thought about with displaced and marginalized populations, those residing in these low-income informal communities, at the core of those efforts. For the IRC, you can take the city of Maiduguri, which is the capital of Nigeria's Borno state, which has seen a doubling in its population due to violence from Boko Haram and insurgencies. So the city has doubled physically, in both number and physically in circumference, you could say. And the IRC had a resilience-focused project implemented in 3 high-risk informal neighborhoods in Maiduguri. The project takes a community-led, area-based approach to identifying risks, developing neighborhood resilience plans, and directly funding disaster risk reduction projects based on community prioritization. And we were just under a year into the project when Maiduguri saw its first case of COVID-19. But thankfully, we were working on a resilience project when an urban resilience crisis hit. So we knew beforehand that these neighborhoods had high populations of displaced people, that people were living on average 10 people per household, that they were high risk of disease from documented previous cholera outbreaks, that they lack access to health and hygiene services, and rely on a daily wage to survive, much as the same challenges that have been talked about in informal settlements for all cities, really. And while this paints a bleak picture, I think the good news is that we knew, because we had this project, that we had community channels that we could leverage for sharing information. But more importantly, I think, as Mark mentioned, the community trusted this information because we were going to them even before a crisis hit. And I think that's probably the biggest lesson to take from here, is that, you have to have a place-based approach in this project in particular allowed us to build that trust with communities, not necessarily focusing on who's displaced or who's marginalized or et cetera, but like, what does this community need from a place-based perspective, and how can we best address it? I'll stop there.
Thank you, Sam. Another really important perspective here. And I think what I love is that you sort of brought it back to the root causes and how, there are reasons that we're dealing with these, the effects of this in a really, why these populations are being more affected than everyone else. And we sort of know those root causes, and we really need to continue focusing on those. And then the point about trust, I think, is also so critical, and we won't be able to get anything done if there isn't that trust within the community. So thank you for that, and for everyone for your really interesting perspectives on the challenges here. So with that, I want to jump into some specific questions that I have for each of you. And so Sarah, let's start out with you. Could you tell us more about the work that Archive does with your implementing partner in Bangladesh, and how you've been shifting your implementation efforts so far based on the COVID crisis?
Sure, thank you, Giselle. I should start by saying that our work wouldn't be possible without partners working locally. So today I'm here representing ourselves, as well as ADESH, who's a community-based organization located in Shavar, Bangladesh, about 20 kilometers west of Dhaka. So they've been in that community for over 30 years and focus on women's empowerment, education, vaccination, and other health campaigns. In 2014, we arrived with the hypothesis that replacing dirt floors, which 68% of the population in Bangladesh lived on, with a durable and cleanable floor would reduce diarrheal disease. Together, we've replaced nearly 300 floors, serving 1,250 people. We work closely with 35 local masons, working together to iterate each phase of the project to achieve a stronger, more long-lasting concrete floor for the least amount of money. So the latest iteration costs about $1.20 per square foot, and the average home is about 350 square feet. We train the recipients of the floor, as well as 2,885 community members, on better hygiene and sanitation practices. We've reached nearly 2 million Bangladeshis with the message of the importance of housing for health. The health outcomes for the project include, this is just a highlight, a decrease of diarrheal disease by 77%, breathing problems decreased by 83%, vermin infestation, medical bills, and everyday stress decreased. So in essence, we've been working on increasing the community's resilience and their capacity to withstand shocks. But this was all pre-COVID-19, and now 70% of the people in the Shavar community have lost their jobs. Food prices have increased, and PPE imported from China is only trickling in. Adesh has been instructed to halt their microcredit loan activities until next year, which was providing them with their baseline revenue. So everyone in the community, including Adesh staff, is facing a food crisis. Domestic violence, which is already high in Bangladesh, has increased, as has women's workloads, as the whole family is home all the time. General health care has been disrupted, impacting pregnant mothers and children the most. So a community which was fragile is now unraveling. And Adesh sent me a quote, which I guess is reiterating what Carolyn and Giselle have already pointed out. And it says, "We have to die without eating at home, and we have to die outside by coronavirus. If we can collect some food from outside, we will see a little smile on the faces of our children. You tell me which one is better." The ray of hope for us is that we're hearing from Adesh's health workers that community members are very thankful to have learned to wash their hands and practice good personal hygiene ahead of the pandemic. In terms of our efforts moving forward, we see ourselves as currently being within the emergency phase, where we need to focus on facilitating access to food and hand washing facilities. 23 million Bangladeshis have limited access to hand washing without soap and water, and 8 million people have no access to hand washing at all. We're moving forward in the early recovery phase, small incremental improvements to the home can provide local work and strengthen households against certain health concerns. Education campaigns aligning with the improvements should also be given. And then moving past that into a new normal, the focus will need to be on community resilience to better withstand pandemics, economic crises, and climate change. This will require infrastructure improvements and health literacy, which needs to be bolstered, but also government support and subsidies are critical to discontinue the vicious cycle of poor housing, poor health, and poverty. There's a need for further research to demonstrate that housing improvements can decrease a country's expenditures on health, and as a result, policies can be formulated. Creating solutions that address the most vulnerable will ensure that no one is left behind.
Thank you so much, Sarah. You know, I think it's great that you brought it back to the home, and really that health does start at home. And I think you've illuminated, I think, you know, the perspective from a really important community and from your partners on the ground. So thank you for that. Danielle, would you be able to tell us about some of the specific ways that COVID is affecting the informal labor force in cities that you're working in, such as Lusaka, and the ways that IFPRI is adapting to respond, especially to the food security challenges?
Sure, thanks, Giselle. Sure, so I'll first talk about Zambia, and then I'll talk specifically about what IFPRI is doing. So in Zambia, I worked in Zambia for about a decade with marketeers and different street hawkers, and about 3/4 of the labor force, the urban labor force in Zambia, is informally employed. It's defined there as a lack of entitlement to annual paid leave and absence of Social Security. Within Lusaka, many of those labor in the informal economy, selling merchandise, particularly secondhand clothing, but a lot of food sellers within the city's more than 60 open-air markets, or they hawk their goods along the side of the road. In Zambia, the government was a little bit slow to react. They didn't initially have as many cases as some other places in Africa, though as of yesterday, they had more than 900 cases. The government closed schools and universities and had a number of restrictions on social gatherings, but markets in particular were not too badly affected. They have been allowed to continue operating, except for special weekly markets. And the Lusaka City Council has tried to procure 300-liter capacity hand washing facilities to be placed in the markets, as well as chemicals to disinfect the markets. The main threat has been to street hawkers on the street. A statutory instrument was launched in mid-March, vaguely claiming that police officers can prohibit or restrict trade or food products in any location which may pose a danger to the health of consumers and traders. So this is a little problematic because it's open to wide interpretation by police. And the mayor in early April said that street vendors would be removed from the central business district in Lusaka. He wanted to instead move them off the streets and put them into the markets. And in some ways, this didn't make a lot of sense, first for the reasons I mentioned earlier when you think about the spatial nature of food systems, but also because it puts these vendors in a more congested setting, in the market setting. A few weeks later, he relented and said they would not be doing this because it was operationally very difficult to do. But it's more reflective of some of the patterns I mentioned earlier that we've also seen in Lusaka of U-turns towards street vendors who are technically illegal under the country's Street Vending and Nuisances Act, but who go long periods being undisturbed and then victim to crackdowns. We saw this 2 years ago when the city underwent a cholera outbreak as well. Now, when I turn to IFPRI, as a research institute, we don't engage in any direct operational programs on the ground, but our mandate is to inform decision makers and donors about which policies work or do not work. So for donors, we try to provide a greater understanding of the institutional architecture governing urban food systems. And this is a very complex setting because you have mandates by public health ministries, agricultural ministries, local government, urban planning, police, revenue authorities. And this is equally true in Zambia, where city councils legally have control over markets and street vending, but there's often clashes between mayors and the Ministry of Local Government, especially if the councils are governed by an opposition party. And turning to governments, what IFPRI is doing is trying to foster cross-country and cross-city learning about how to maintain resilient urban food systems in crisis periods. So we have an ongoing COVID-19 blog series on this topic, and just 2 weeks ago, we set up a policy response portal known as the CPR, where we're tracking policy responses in more than 20 African and Asian countries to COVID in 9 different policy domains, including highlighting different restrictions and innovations to supporting informal food trade. So I'll leave it there. Thanks a lot, Giselle.
Thanks, Danielle. Caroline, let's turn to you. And what we're wondering is, if that's similar to what you're observing as well, and what new challenges COVID has brought to the women you work with in informal and vulnerable occupations. And maybe you could also talk a little bit about the way that WeGo is ensuring that informal workers' issues are recognized and promoting policies and plans that address those concerns.
So thank you. I mean, from a gendered perspective, we must remember that many of there's a disproportionate number of women who work in the informal economy, but also that schools are locked down. And I know as a mother myself, what impact that has on all of our productivity, and it certainly is having an impact on women informal workers, with them often being unable to respond to the opportunities that are there. So obviously, WeGo has detailed in-city work in a range of countries and cities. Our website's a good place to look in terms of both the impact, but similarly to IFPRI, we're also looking at policy responses and doing our best to track what's happening, and particularly to share some positive examples. So I direct you there. I just wanted to give you one example of work that I know well, because it's a work that in South Africa, and it picks up on a theme that I think is particularly important to this group and has been mentioned a lot already around the role of the informal food system in food security. So, the research that IFPRI and others, particularly the African Centre for Cities, has done when they're doing detailed kind of analyses of household food security surveys, just consistently shows across the global south how critical the informal workers and particularly distributors are to food security, and particularly for low-income households. So in South Africa, we focused on advocacy work to get informal retailers particularly to be declared as essential service workers. So we both had an inside and outside track. We provided some technical advice to a presidential committee, but also had some work with civil society organizations to push for this. And within a week into lockdown, they were declared essential service workers, which is unusual if you look at what's happening in other countries. A critical element of this is then to come up with safety guidelines. So we worked very closely with public health officials from 2 universities to make sure that informal food traders were trading safely, protecting themselves and of course their customers. So that we have guidelines, we've translated them into 10 different languages. We'd love feedback. The disease is a very fast moving phenomena, but also we want content to be appropriate to particular context. Things are the actions that we're taking, and we constantly, like many of you on the panel, are sharing good practices where we see them. Enough from me.
Thank you so much. No, it's so important that you've highlighted, I think, several things. One, I love the focus on solutions and best practices. And, you know, obviously there are so many complex challenges we're all dealing with. I think, you know, it's great. And that's one of the reasons we're having this panel today, is to highlight some of the positive things and the solutions that we can focus on together. And I also think that, you know, your work in dialoguing with government and advocating for informal workers so that they're protected, and you've seen some real impact from that, it's so critical. And I think it also gets to Danielle, some of your work too. So thank you for sharing that. Mark, I would love to hear more about what your placemaking network is doing to protect the urban poor in public spaces that are, you know, in often overcrowded informal neighborhoods or on streets and in market environments.
Thanks again for the opportunity to share what we're doing. There are a couple of things that we are doing, and our friends and colleagues are doing in informal settlements across the city and in different parts of the world. And in Nairobi and Kenya at large, we have people who are focusing on provision of wash stations in informal settlements. So really, it's repurposing or adding wash facilities in public spaces in informal settlements. And we've seen this in Kibera. We've seen again the same thing in another informal settlement in Nairobi, where local youths who are part of the Placemaking Network Nairobi actually doing. We've also seen a few youth groups who are now integrating urban agriculture in their public spaces, so vertical gardening, to ensure that they have fresh food, but also now everybody is looking for an extra coin. And through this kind of interventions, they're able to sell excess produce and earn some sort of income. The other thing that we have seen also being done by certain groups that are part of the network is we've seen a proactive action towards disseminating information. Public art has become a big thing in sharing information about COVID. And we are seeing graffiti on walls, on strategic facades across the city. And that's really encouraging, you know, and I think in many ways helps to get everybody talking and knowing exactly what to do. Like I mentioned, information is really a problem. The other thing that we are seeing a lot is organizing around community awareness, door-to-door awareness creation. Why do people need to wear masks? You know, and you know, it's not just about why you need masks, but also providing that mask. So we have people who are providing masks at the door-to-door level, and also just raising awareness on the need not to share masks, because we have cases where there's only one mask in one household, and you know, up to 5 people use it, and you don't know if you lend it to a neighbor, you don't know if it comes with the virus itself. So that kind of awareness is something that is also happening. And we are also seeing a bit more focus on children and the need to ensure their mental health. So we have a few initiatives that target play and some sense of imagination among children. You know, and they don't have to go to those shared spaces where they interact with other children. But then with this kind of play opportunities like kids, they're able to play within confined spaces. And in many ways also helps them to be active mentally and to engage in school. We're also seeing lots of effort to ensure that public spaces have running water. This is always something that is missing in informal settlements. Yes, they could have these risk-reducing services, but then there's a need for somebody to bridge that gap, especially where government has failed, and we also understand that they are struggling, they're dealing with a pandemic that they know not much about. Civil society organizations are moving forward to ensure that there is adequate supply of water all the time. Lastly, I would say we are also seeing a lot of positive response from government, who are also part of the network, and they're expanding sidewalks. That's really something that I'm proud to see in Nairobi. Yeah.
Wow, Mark, you've touched on so many critical things. You're doing so much, and I think it's really heartening to see, you know, the things that we've all been advocating for so long, such as, you know, basic services, running water, or even the wash facilities. I think are absolutely brilliant, and you know, perhaps it's an opportunity to really get these things implemented for this public health challenge, but it'll also, you know, help with the long-term recovery and sustainability in these areas. Or the urban agriculture efforts are also, I think, super important, that people are taking control of their own, you know, future with that, as are the messaging. I think getting those trusted messages out by, you know, community leaders that are part of the community, and also advocating for health literacy and telling people why certain restrictions are in place, and also providing them with opportunities to stay safe. These are really great efforts. So thank you for sharing them with us. I think it's great to hear that. Emily, I would love to hear from you more about how you're adapting your public space work in Yangon to address the unique challenges that vulnerable residents are facing there.
Yeah, thank you. Yeah, so as a quite young placemaking organization, we hadn't been working directly on any disaster response until COVID hit. However, when COVID-19 started, we quickly got pulled into all kinds of emergency response activities. And then doing that, we realized that actually we were quite well placed to do that kind of work. Of course, because of social distancing implications for public space, but even more so because of our wide community networks. Yeah, across the city, our close relations with local government representatives, as well as a connection to funders. So yeah, I think a lot of our work has really been more around being able to network and connect and share best practices at a very local level. One set of activities that we've been doing is helping neighborhood groups and sort of co-design committees that we worked with in the past to create safety guidelines around some of the public spaces that we had worked on. So protocols around social distancing, hand washing stations, yeah, sort of really just supporting them in implementing that. Similarly, we did a bit of work with local government representatives around the operation of markets. There have been some really, really cool, yeah, innovative sort of adaptations here quite early on around mobile vending, around trishaw drivers helping with delivery of food, new layouts for markets. So, and sometimes representatives of local government or members of parliament, they would have ideas like this, but they wouldn't be quite sure how to implement them. So we've just been trying to help with design advice, or actually building some simple things, making sure that they could realize their ideas and so that they could spread between townships. Our biggest effort really has been around street vendors. And again, really because of the community networks, we were able to enumerate, identify a lot of these street vendors, seeing how they were not really being reached in support programs. So we have now enumerated over 5,000 street vendors, and we are supporting many of them with direct cash transfers and disbursements of PPE. And we're also doing a broader campaign alongside this around the value of street vending to just help build up that appreciation further, which will hopefully have more long-term impact. And as of just the last 2 weeks, we're now also working with another partner to actually support these vendors in providing free food for those who need it even more, which is also a really nice shift because it puts the street vendors in a position of actually helping rather than being in need. So,
Emily, thank you so much. I think it's great to see your local perspective and the things you've been able to implement on the ground with the communities and the populations that you know. And I also noticed that you mentioned something similar to what Caroline said, that you both have sort of created some safety guidelines for public spaces, and perhaps it would be a nice opportunity to exchange and to compare notes later. With that, Mike, I would love to move to you and to hear more about how the refugee-led prototypes and design projects that you've been working on have been adapting to this new COVID reality, where obviously overcrowding is frequently a challenge. And then, also think about how you are adapting the design of the public spaces in this new context.
Yeah, well, one story to share. There's a refugee from Congo living in Nakivale named Patrick. He has a design firm called Unexpected, UNXPD. And he designed a industrial quality hands-free hand washing station, like welded out of metal, like a big oil drum on top, mixed with a solution. And the NGOs saw that. Alight, formerly American Refugee Committee, saw that. And they actually ordered 100 of them from him at $100 a piece. So it's it's just really interesting that, and even there was no hand washing station at the entrance to this camp. So we just put it there. And that was actually how then UNHCR saw it, the local police saw it. And then he's been getting all these orders, even though they have access to airplanes and supply chains and everything. Local is the best solution that has come up. And another example of that in Kampala, there's a group that we've been supporting called the Ghetto Research Lab. And they've designed they saw that and designed a hands-free washing station that's only $10. That's just built out of like scrap wood. And those have been placed all around. So I just think there's been some really great aspects of design, locally led design. And also, as Cecilia mentioned, there's a ton of innovative low-cost solutions that people living in these settlements understand how to do that international organizations may not be fully aware of. And also just to echo kind of what Mark was saying around a lot of I'm battling the sun here, around graffiti and using culture to get messaging out. I've been working with Alight and IDEO.org on some different visual messaging, and have also created this online campaign called In Our Hands, which has used influencers across Africa. It's gotten over 300 million impressions. And we're thinking about transitioning that more towards masks. Because in opposite to your first question of what's the biggest barrier, I think the biggest need, or the most kind of doable and affordable solution for places where it's really difficult to build a healthcare system is really around masks. There's a researcher named Dakai who's been pushing this concept of universal masking. He has a video that's gotten around 50,000 hits that says in his research that masks work if 80 to 90% of a population wears them. So we've been creating, YouTube has a feature where you can add closed captioning by any language, and you can just go into the video link and add that. So we've been having residents of Nakivale, as I mentioned, from 10 different cities, adding their languages to this really important scientific data, but that is only in English at the moment. And we're also doing this kind of street art stuff. There's an American artist named Thomas Wimberly who created kind of an iconic looking like nurse with an American flag mask on it. And I just sent that to some of my refugee colleagues, and without even asking, they made it into a South Sudanese mask, a Ugandan mask, a African Union mask, and those are being put up and painted around the different neighborhoods. Like New Buja is where the Burundians are, because Bujumbura, it's called New Buja, and they're making putting up the nurse with the mask on top of that. And the last thing I just want to highlight, you mentioned data before, that being really necessary. One of the innovative programs that we're working with is called Kuja Kuja. It means come come in Swahili, K-U-J-A, K-U-J-A. And what it is essentially is a customer feedback mechanism. So the refugee-led organization called Umbrella, which has gotten like a $15,000 grant to implement water stations and doing like 15,000 liter water tanks to put water in these places where I mentioned the extremely vulnerable population was evacuated from the reception center. And they've been collecting information and phone numbers. And they've been collecting over 600 ideas of what people need. So we've reserved some of our funding to really respond to what the ideas that are surfacing from the community. This is a technology that allows us to really get a pulse and also witness trends. Because in the very beginning of this, I was hearing even leaders from the camp saying that COVID was for white people and Ebola is for Black people. And so there's a lot of misinformation, and we're kind of getting to see how things have gone from in the beginning saying we really want information, what is this, to now, because there's a government mandate to be in public with masks, there's a lot more demand for masks. And one of the other ideas that, again, Mark mentioned that we've gotten through this Kuja Kuja was parents saying, can we have toys for our children? Something as simple as jump rope or a tennis ball, so that children will be entertained at home and not have to gather in crowded places. So I really think, that's what's interesting to hear from all the panelists is, this has evolved over time, kind of like, all right, this is happening, what's going on, how do we deal with this? And it's kind of, identifying these hand washing, culture information, mask wearing. And so it's really great to be together on a call and hearing some of these similarities as we're all trying to make sense of this situation.
Mike, I couldn't agree more. And I think I love the ideas and the solutions that you have brought up today that are locally led and that are, by the community, for the community. I think you've brought a lot of really great ones that we all could, would love to support and would love to spread the word on and make sure that they're implemented in more places. And then the mask idea obviously is so important, especially in the areas that many of us are working in where the physical distancing is simply not possible. So we have to have masks, but they need to be socialized and they need to be culturally, the messaging and the socialization needs to be culturally relevant for that community and population. And that sounds like exactly what you've been seeing and what you're promoting. So thank you. So helpful and so enlightening to hear about those ideas. And so Sam, lastly, I want to turn to you to better understand what you can tell us about the ways that IRC is mitigating COVID in the urban humanitarian settings that you're working in by implementing these measures that are sensitive to pre-existing needs and mitigating the impacts on health, protection, livelihoods, food security, all the things we've discussed today.
Yeah, thanks. I guess just briefly, it is interesting to sort of see, I think more interesting than how we've responded is how our response has evolved. I think it's very much the case for all sort of global actors or people with a broader mandate. Whereas first we were very much, putting our own staff safety and health first, figuring out what we can continue working on from a pure life-saving standpoint in terms of critical information, critical healthcare services, what can continue on that front. But now we're, I guess, kind of more what Mike's saying, like trying to get more creative based on the places where we're working. And I think that that's really important, right? That comes with time. And I always like to say, the first 3 months was spent us putting our own oxygen masks on, but now we're turning to our passengers next to us on either side and thinking about how we can put their oxygen mask on, be it city governments, refugee-led organizations, some of our civil society partners, and really thinking about how we can nuance, I think is the word I'm looking for, some of our responses. So it's not just like everybody quarantine, everybody risk your livelihoods, stay at home. And part of that, maybe I'll highlight just one thing is, we have an online information platform called Cuéntanos in Latin America, and it's replicated in other contexts. You can go to cuéntanos.org right now. And if you are a Venezuelan or a vulnerable Honduran or somebody in El Salvador, you can get real-time information about, based on where you are, what services are available to you, and based on what services you personally need. I think Mark is logging on right now. And so, so I think that's really, now we can have one-on-one conversations with people and have much more customizable approach to people's needs as it moves forward. And I think this is a placemaking conversation. So just to bring a placemaking aspect to this, you're never gonna have town halls or public squares that are all identical, right? At least I hope not. That's bad design in my opinion. The same way, you shouldn't be addressing these places with the same kind of response in Harare as you are in Kampala, as you are in Nairobi. These places are different. Yes, they're all low-income informal settlements, but the needs are different, the perspectives are different. And I think if you really bring it down to a neighborhood or a household level, you'll start to see those nuances a lot better.
Yeah, Sam, no, I couldn't agree more. I think we all need to understand as the pandemic does evolve, how we can tailor and make place-based approaches for each particular context and population. So important. Thank you all so much. I want to just move quickly as we're a little bit short on time here, but I'd like to ask each of our panelists to just give a succinct call to action. Some of you have already described some of them, but just the number one most impactful thing that every attendee could actually take to ensure that these COVID response resources reach frontline responders that are implementing actions and support vulnerable populations like refugees, informal dwellers, and workers globally right now today. So we'll do that in the same order. Sarah, let's start with you. What's the #1 most impactful action that all of us can take today to support your work?
Thanks. So for us, with many countries in the global south living through the rainy seasons right now, what we want to do is build hand washing stations that take advantage of the monsoon rains. We've designed a 500-liter hand washing station that fills with water from roofs, and where both soap and water are foot operated, so you're not touching anything. We can place these in markets and reach about 1,000 people per filled tank. We're requesting a health worker, wearing PPE, of course, at these stations to provide up-to-date information on COVID-19 and help instruct on hand washing practices. They may also help respond to other general health concerns. So that would be our kind of one big idea, but we can't really ignore the fact that people have lost their incomes and that the price of food is high. So our local partner Bangladesh has started handing out food rations. A $10 packet is providing sustenance for a family for 5 days. And so we're partnering with the Desh to provide funds to help them continue that food ration, but also to pilot the hand washing station with a health worker. And we would like to see how that goes so that then we can kind of deploy that not only throughout Bangladesh, but in other of our kind of country projects that have a rainy season as well. So I will post the GoFundMe. We're not trying to raise a ton of money. We just want to be able to do something really quickly. And so I'll leave it there. Thank you, everybody, for your help.
Thanks, Sarah. So supporting Adesh on the hand washing and the food rations, fantastic. Danielle.
Well, as I mentioned earlier, IFPRI is a research institute. We don't do operations, we don't accept funding, but what we do is we advise governments, and we have gotten a lot of requests by governments for policy advice about how do you keep particularly food markets operating at this time, how do you keep them resilient? And thinking about this is not just a one-off, this is a dramatic event right now, but cholera, typhoid, other types of public health emergencies are quite common in many of the cities we work in. And so my call to action would be, I think what we're starting to do here is having some repository of positive actions at the subnational level of what works for keeping food markets working. As I mentioned earlier, IFPRI has the CPR. It's done a good job of integrating some of this information, but often not, certainly not capturing the diversity of policy actions at the subnational, at the neighborhood level that some of you have already mentioned. So I'd be grateful for any kind of crowdsourcing of some of these policy actions that we can incorporate into our portal or share with some of the others like WIEGO and other portals that my co-panelists have mentioned.
Thank you so much, Danielle. That sounds great. So we look forward to exchanging ideas and reviewing the best practices and the policy best practices in that repository. Thank you so much. Caroline.
So, I mean, I feel in many ways we're in a dark moment as a world, but I also think that there's some positives. I do think this is our chance to reimagine cities and particularly public spaces within them and to make them much more people-centered. So really mindful of this audience, and I know that there's some, amazingly innovative, creative urban designers, local government officials, people who are working on how to reimagine and reorientate public space. The call would be to work alongside informal worker organizations and to really think through how to do this in a way that minimizes the risks, but also maximizes their contributions to cities. So, I've really been struck by, the lovely just examples that Placemaking X has put on their Twitter feed about how you can change streets into, they're wonderful environments in terms of minimizing risk because they're open air, and you can still maintain social distancing between vendors and customers. So it's really to use space in a much more creative way. So that's my call to this set of people.
Absolutely, Caroline. Thank you so much. Mark, let's move to you.
Yes, thanks again for this opportunity to be able to give a way forward on what I think should be done. From our side, what we think should be done is that we are seeing a lot of interest from governments to repurpose their public spaces, their public markets. There's a lack of design support. So calling on creatives to provide support to local governments to really rethink the city, just as Caroline said, but also to help repurpose these spaces. And most importantly, really to protect informal settlements. Governments need to do a little bit more, to ensure that there's no eviction, especially at this point in time, and that they provide public spaces in these informal settlements, at least because COVID-19 is here to stay, at least for a few more months, or at least a few more years.
Absolutely. I think the design expertise is something that not everyone has. So those are really great ideas. Emily, let's move to you.
Thank you. I'll make a very quick plug just for the ongoing campaign we have for street vendors. We have a digital cash transfer mechanism, and a lot more cash is needed for that to really keep that going. So all contributions through that go directly to street vendors. But more generally, really, is just a realization how important it is to find better ways to get funding to local organizations, very much community-based organizations who are just, proven so vital in a time like this to really reach, be able to recognize what's needed, reach those people, and who can do so much with relatively little. And it's frustrating to see how incredible organizations here can't reach their full potential because funding isn't reaching them, whereas big organizations here are taking months to reallocate their funding and come up with new ways to support. So.
Of course, so that's wonderful. So there are opportunities for all of us to support street vendors, locally where you're working today. So thank you for that opportunity. That's fantastic. Mike, let's hear from you.
Yeah, well, despite this call being filled with experts and really great, and the participants as well, really, I want you to believe and to know and to understand and to unlearn that local capacity is incredible. They might not have the same education or the same experience, but really, I think what's been amazing in this time is that people are really open to partnerships that would have been deemed too risky before, or kind of outside of their, comfort zone. But a lot of international staff has left. So they're kind of left with no choice but to work with the locals. And in general, I really think that that's, I've always, or for the last few years, thought that that's needed to deal with displaced people in the future, is to not have them be dependent, not only have, these, aid workers doing humanitarian work, but really looking at more of it in a development sense. And so my hope is that after COVID, we'll see the efficacy and efficiency and cost effectiveness of these local responses, and that will become more the norm. Because really the numbers of displaced people is growing so dramatically, the funding is drying up. So I hope that that's one of the silver linings. And if you want to look at some of the projects we're doing, it's to.org/COVID. That's where we have the refugee projects. And, we've done pretty well fundraising. It's actually interesting to see that people are really learning about the importance of protecting vulnerable populations. That's always been a humanitarian principle, but I think the general population is kind of becoming more aware of that and the need to support those vulnerable, or we're not supporting anyone, including ourselves.
Absolutely, Mike. I think that it's a great point, and I think we've always maybe been advocating for working with the local community, but now we are sort of forced in a lot of ways. So great opportunity, and I know that you will able to connect us with many of those local grassroots organizers. So thank you. So Sam, I would just turn to you last before we have a couple minutes still for questions.
Yeah, I mean, just really briefly, picking up on what Mike said, you're not gonna come up with a vaccine without a scientist. Don't come up with a neighborhood solution without the neighborhood. I think it's pretty simple as that. And just as a call to action, that's one. Two, I would just say, if you're thinking of donating to the IRC or some other organization, don't. Pick a refugee-led organization, find out where they are, figure out ways to get money to them.
Thank you so much. And so we will, yeah, I see Mike and so many of us agreeing with that. It's an excellent point, one we don't hear enough. And so again, I think this is a really awesome opportunity to bring together people who are working directly with those organizations on the ground and who can direct our funds and support to those that need it most, and the ones that are, you know, leading their own efforts to improve their neighborhoods and communities. So thank you, everyone.
It's a personal opinion. It's not the IRC stance.
Yes, of course. No, we recognize that, but I think we can all appreciate that. So we have just a couple minutes for questions before we wrap up. Francisca, I'm going to turn it to you to ask some of the panelists the questions that we've gotten.
Great, thanks, Giselle. We've gotten great questions, and because of time, I'm going to try to merge a couple of them to address them. So we've talked a lot about the importance of trust with governments, organizations, communities. My question is, how can placemaking help build this trust and break barriers to reach communities on the ground?
Does anyone want to jump in and take a stab at that one?
I can share from our experience briefly.
Great.
So one of the ways that we've seen this work is working with these organizations that have been in these informal settlements. Do not bring new organizations into an informal settlement or a city that they've not been working in. It is important to activate networks that are existing and to ensure that these people, and working with faith-based organizations, that's also important because they know their constituents. So you really need to target people who've been there, who know the people, and people who can be traced and tracked. And of course, who've built confidence and trust with the local people.
Such an important message. Did anyone else want to jump in, or should we move to the next question? Okay, Francisca, let's hear the next one.
Of course, this one is related to the role of central governments and how can they reach communities on the ground. So someone's asking, central government is doing their bit in many countries, but it seems that the resources are not reaching communities because of existing barriers. Is there an example, a working model where government has worked smoothly with community structures in reaching marginalized people, either for food distribution, sanitizers, or for information? So has any one of you have a good example of governments working with communities on the ground?
My answer is no. And I think there's a reason for that. I think, you know, there is a role for organizations like the IRC and others and refugee-led organizations to play as an intermediary. I don't think central government should be necessarily thinking about how they can specifically respond in some of the neighborhoods we're working, but more how can they empower other organizations to respond. And I think, like, now, if you think of Kampala, for example, in some of the informal settlements there, it's actually the refugee-led organizations such as Yared that are the first responders, and doing a much more efficient job than the central government. I'm not saying that the central government doesn't have a role to play, but it should be an empowering role to both civil society and to city governments. That's the model that I see working more so than governments taking on the job themselves.
Mm-hmm.
Sorry, Giselle, just to add on to what Sam was saying. I mean, I think what this crisis has really spotlighted is the extent to which informal workers, the group that we really, you know, tracking, have fallen are outside of social security, social protection and social security nets. And I do think national government has a critical role to play, and there is an opportunity to incorporate informal workers, probably for the first time in decades, into these social security nets. And where the places where monies have been able to land, so things like cash grants into the hands of informal workers more quickly, do tend to be the places like Brazil, where they're already in some kind of database. And where they're not, there are often, you know, informal worker organizations that can help speed up that process. So I do think we mustn't dismiss national government. I think they're critical players for this element of securing protection, in our case, for informal workers.
Absolutely. Francisca, do we have time for one more question?
I think we have for one brief question. So I'll finalize with how can we make the case during COVID for creating healthier, more equitable places now that improve lives for both now and into the future.
Does anyone want to take a stab at that one?
Sure. I mean, that's exactly kind of, you know, these places were in crisis environmentally, in so many different ways. And so by using some of the awareness around the need to protect people, we can put in place some of the infrastructure. But I just caution that it's, you know, one of the donor challenges is it's more exciting to build a hand washing station than to keep it filled with water and soap, much like the problem you see if people build a school but aren't as interested in teacher salaries. So just want to say, yes, we're getting more infrastructure in places where it hasn't been but is needed, but there's going to be a need to sustain that.
Absolutely. No, that's so important. The maintenance and the ongoing sustainability of all of these interventions is one of the most key things. And I think everybody tends to forget about it after the emergency crisis has waned. But this is something that, you know, we've been working on for a long time, but we need to make sure anything that is implemented now, because it is kind of this moment of opportunity, is maintained and continued into the future by the communities themselves. Well, I just want to thank all of you so much. This has been an absolutely amazing discussion today, where we got really amazing and specific actions that we all can take. So I just want to thank you all for your time. And I do want to give just a couple of quick takeaways to close with here. And so what I just wanted to mention, and so many of us have discussed all of these things today, but you know, what we do know about this disease has been evolving so quickly, and there is still so much that we don't know with certainty. But one thing, and I think Mark, you said this too, one thing that we do know is that we won't be getting back to anything that feels remotely like what we used to call normal for at least 12 to 24 months. And those are the optimistic estimates. And I think for me, at least mentally, it's been a really important exercise to acknowledge that fact and to settle in for the longer, like a longer time than initially anticipated. And I think what that means for me is that we need to start planning today for our new reality. And I do think that there are some opportunities here. Obviously, you know, this would be among the great many tragedies that this pandemic has brought. But I do think there is a chance to come together as human beings, really, to finally appreciate the true value of our shared public spaces. And that includes streets. You know, public spaces and coming together has never been more important for people now that they're stuck inside and they don't have any opportunities for that. And I think, you know, for too long, we've sort of leased exclusively so many of our public spaces like streets to really a tiny percentage of the population that has cars. So I just wanted to sort of revisit, when we consider, you know, how the virus spreads, to me, reserving those vast amounts of public space just for cars makes even less sense than it ever did. And so I just wanted to mention the epidemiological perspective of this, because typically we think about, you know, 3 modes of transmission. And so the virus that causes COVID, it is spread, as we all know, I think at this point, through respiratory droplets emitted by infected people when they, you know, cough, sneeze, talk, or even just exhale. And most of those droplets, you know, they quickly fall to the ground. And that's why we have things like physical distancing at 6 feet or 2 meters. And then the second mode that we don't hear that much about, but because we know it's pretty low risk, but the fomic transmission that happens when a surface has been contaminated by someone who's infectious, and that serves as a point of transference to someone else. And that, of course, informs our strategies like not touching your nose and mouth and washing your hands frequently. And the third one is one that has not gotten very much attention from either WHO, CDC, or others, and that's the airborne or the aerosol transmission, which comes from inhaling those smaller viral particles. So, you know, if we think about this, imagine that I sneeze and I'm infectious, there'll be those larger droplets that fall to the ground, but also smaller droplets that stay in the air for longer. And so the guidance for staying away 6 feet or 2 meters also helps with the airborne transmission, you know, because the smaller viral particles, they stay aloft and they spread out in the room, for example, beyond 2 meters. But the transmission is also a function of how much of the virus a person is exposed to. You know, so if you're close to me and I cough, and even if I miss you with the big droplets, you could inhale those smaller particles. And if you're 12 feet away, by the time they reach you, they will have mostly dispersed. So they might be in the air, but there'll be fewer of them. And I would just want to bring that to our conversation about thinking about the difference between being inside and outside. So when you're outside, if I cough or sneeze, it's going to disperse really quickly because you have wind and a large volume of space to ventilate and dilute the concentration of infectious materials. And I want to bring that up because there really is pretty much a consensus at this point among public health experts that being outside where the virus can be diluted is generally much safer than being indoors where there's less ventilation and air, making it easier for the virus to spread. So that makes a lot of sense, I think, to all of us. But when we think about how to redesign public spaces in this COVID world, for me, it's one of the most important design factors to keep in mind. Because we know that there is a really strong body of evidence at this point that we've all been working on for a long, long time that clearly shows that spending time outside in nature is one of the most effective medicines we have for decreasing stress, anxiety, mood disorders, and also opportunities for physical activity, even like a short walk and getting a little sunshine on your face. They're some of the best ways to prevent chronic diseases and conditions and strengthen the immune system. But unfortunately, in so many places, and some of you mentioned this, access to nature and safe outdoor areas for physical activity, you know, it's an equity issue. We don't all have it, and it exacerbates the health disparities that COVID has further exposed. And some cities are shutting these areas down. And so I wanted to just mention that those are some of the concepts that I've been keeping in mind as I work with my city clients, like City of Lima or Renca outside Santiago or City of Atlanta even. And there's those couple of things with those concepts at the top of mind that I've been advocating for. And so one is to keep the existing public spaces open where possible, while enforcing, of course, physical distancing, mask wearing, as Mike mentioned, and making hand washing available, which so many of you have mentioned, innovative strategies for doing that. Especially in areas that tend to get congested or some of these informal areas where we already have overcrowding challenges. But also to consider adding new public spaces for pedestrians and cyclists to ease the congestion on, let's say, narrow sidewalks, parks, plazas, or other areas. And it also helps residents stay close to home when they're acquiring basic goods and services. Obviously, this is a really big spaces challenge in a lot of these communities that we're working in, but I think we want to remember that the public spaces are not just for cars anymore. They really should be for all of us, and that helps all of us. And then finally, a strategy that I know, we've all been thinking about, not always in these contexts, but across the world now, is sort of one that is simultaneously solving multiple problems at once, which is turning streets into these massive outdoor open air cafes. And, dozens of cities are implementing these in different ways, from, wealthier to ones that are more vulnerable. But I think it's great because it allows residents to get outside of their crowded home environments and to breathe some fresh air, get some vitamin D, take a walk, but also to support local street vendors and restaurants while maintaining a safe physical distance, hopefully. And I think that's the direction that all cities are moving in anyway. It's kind of inevitable and something we've all wanted for a long time, but it also, in this case, makes health and economic sense in a quite extraordinary moment. So I just want to thank you all again for everyone who joined. The recording will be posted on the website, and we'll be accompanying it with all the follow-up materials from panelists so you all can find ways to support. So Ethan, I just want to turn it over to you for the last word.
Thank you, Giselle, and thank you, everyone. So yeah, it is certainly a time to, in a way, turn upside down the way we shape our cities, to start with the people that they're meant to serve, and to start with public spaces that are safe, healthy, and comfortable for welcoming to all. This has been really helpful to really understand the depth of the challenges that we're all facing, to get us a little more connected to these most vulnerable communities. We all need to help tell these stories more, get them out there. I think people really do want to learn more. They want to be able to support this in ways that are effective. It's inspiring to see some of the short-term, low-cost solutions that are out there. We're going to keep sharing those on social media on the page, and hope to get funds moved in those directions. We also want to make sure we're thinking bigger about the systemic change that this opportunity offers, about how we work together, collaborate locally in communities in a more community-led way, across regional networks and global networks. We want to do our part, certainly, to continue to build on this conversation. In a way, we see this, we hope you guys all will join us in sort of a continued learning network on this topic, and invite new partners in that can bring in new ideas, new perspectives. All right, thank you, Sam. We see this. So last year, Placemaking Exeter launched with regional networks. We have 14 regional networks that are emerging, and I saw a lot of people are in the Yandi. Rohi is working with Marco Jaldas to build an African regional placemaking network. We have an Indian network, a Southeast Asian one. There's this really strong Latin American one and a Brazilian one. but we also want to support cross-cutting networks that are learning and action networks as well around topics like informal communities. We're going to do upcoming ones with children. We'd like to do one on refugees. I think that include and overlap with the topics we discussed, and vendors as well, street vendors. There's many others, but those are just some of the topics. So we encourage people to suggest those efforts. Anyone in the audience to join Placemaking X as an advocate and offer to help support the learning and action around these topics. And we'll do future conversations on this. Also join the regional networks and get active in there. And lastly, sort of on a lighter note, next week, one of our Australian partners has started something called Porch Placemaking Week, where we're encouraging people around the world to come outside of their homes and activate their whatever space they can at the front of their homes, as we start to think more consciously about how we contribute to, can support public spaces, can connect with our neighbors in safe, distanced ways. But in a way, this is, this era, as Caroline said, it's sort of a dark time, is that we've all retreated to our homes, into our private space. And I think the global north, a lot of our role, with placemaking has been to say, don't make the big mistakes that we've made in the US in terms of urban planning. And one of the big ones is we have, retreated into our private homes, our cars, the backs of our homes. And it's time to take this opportunity as we reinvent our relation to each other and our places to come outside, to reinvent, to turn our homes inside out, our businesses inside out, to take over the streets in ways that contribute to everyone's shared experiences. To debate who uses these spaces and how do we best use public space best. And this Porch Placemaking Week is an opportunity to do that. So we encourage, we want lots of examples, all kinds of crazy ideas. A lot of these ideas you've talked about can be highlighted go to porchplacemaking.com, and we'll continue some of the conversation next week. And we'll have some online webinars or gatherings as well to just showcase what people are doing and share our conversations. So with that, thank you so much everyone for being part of it. Sign up on placemakingx.org for more information and join, be part of all the organizations that are represented amongst our great panelists as well. So thank you, really appreciate it.